All right, welcome into another episode of For Your Health podcast sponsored by Roane General Hospital. I am your host, Andrew Miller. Got a couple of people here with me today, and we're going to talk about one of my favorite topics, food. Although we're not going to talk about food that I love and food I would love to eat. We just had the Walnut Festival a few weeks ago, and yeah, I probably am not going to admit what I've eaten during the Walnut Festival to these two because we're talking about food is medicine. We've got Missy Painter, the West Virginia University Family Nutrition Program Nutrition Outreach Instructor, and we're also joined by our Prescription for Your Health Director, Ms. Kim Mertz. Thank you two for joining us.
Thank you. You make us sound judgmental, though.
Yeah.
Well, it's pre-judgmental. I guess that's the word for judgmental. I am eating well, and so you guys don't have to get mad at me for what I'm doing. I do want to introduce this. Food is Medicine is a model utilized to prevent, manage, and treat chronic health conditions through nutrition. Prescription for Your Health is partnered with both FARMacy, that is FARMacy, West Virginia, and the West Virginia University Extension over the past 4 years to provide a food and medicine program each summer. The impact of FARMacy West Virginia has expanded the nutrition-based offerings supported by grantors, including the Claude Worthington Benham Foundation and Sisters Health Foundation. The reason I'm excited about this, and Kim, you'll know this through some of the podcasts that you and I have talked when it comes to food. Missy, number one, thank you for joining us, but this is, in my mind, in health journeys, the hardest part of getting healthy. It's not being able to get active, although that can be difficult for people. It's not being consistent in the gym or consistent with cardiovascular exercises, walking. It is proper eating. It is eating good food. It is eating the right things, what to eat, when to eat it, how much to eat it. Food is medicine is almost, to me, Missy, it's almost like the most obvious thing to say. You eat because that's what feeds your body to live. Before I talk about any of that stuff, though, we've already talked to Kim about who she is and what she's done. We know that she's director of Prescription for Your Health. We don't know you. So I wanted to give you a chance to introduce yourself to our listening and viewing audience. Where did you come from? What got you to where you are today?
So I actually started off with the West Virginia Extension in Jackson County. And throughout the years, we expanded over into Roane County because there was a need. And after meeting with Vicki Withers here at Roane General, we started with the FARMacy program. So I've been with Extension for the past 10 years.
Okay.
Working in Roane County for the past 4/5 years, depending on who you ask.
Yeah. It kind of blurs together there at some point. You know?
So, yeah, and food has been a big passion of mine for years, and we just added the nutrition aspect of it in, and it's all just came together to marry into this great program where participants get to come and enjoy a class, actually cook the recipes and try them before they take them home.
Yeah.
So it's pretty exciting.
Well, Kim, I'll feed this over to you as the director of the Prescription for Your Health program. How did this come about? How did this collaboration with the West Virginia University Extension Office and with this FARMacy program, how did this come about when it comes to Prescription for Your Health here?
Sure. Well, one of the pillars that we really concentrate on in Prescription for Your Health is nutrition education. So, of course, we're looking for all kinds of resources with that. I cannot take any credit for that. That was before my time. So that credit goes to Vicki Withers. She's our nutrition education coordinator. And so that was just something that kind of worked together. FARMacy with an F. FARMacy West Virginia is a resource that is expanded all throughout the state. So I think a couple years ago they served 24 counties, and it's up to, do you even know how many?
I think there's like 50 sites at this point.
It's really big. So we were one of those first sites in Roane County at Roane General Hospital, about 4 years ago, and 21 that got started with it maybe 5 years ago, if I do my calculations right. So it just was another resource for Prescription for Your Health because we knew that if we just give people a membership to the gym and say, here you go, here's your free membership, good luck, that's probably not going to be enough for the general population. So that's the importance of nutrition education, and it just was one of those supplemental programs that they wanted to offer as an option for people that they can take advantage of in the program.
Well, and something that you just never can tell, you provide this and you don't know if anybody's going to utilize this. Obviously, that has happened. People have utilized this Food is Medicine program. Well, I want to ask you guys, what is Food is Medicine? What is this program that you guys are offering in conjunction with this Prescription for Your Health?
You can speak on Prescription for Your Health, and I'll do FARMacy.
Absolutely. So Food is Medicine, it's not a new concept. This is evidence-based information that we're utilizing. This is not something that Roane General came up with. This is happening all throughout the country and other places, of course. So it's a certain model that we look at in providing nutrition education. Some of those tiers, you're looking at general population. Some of those are disease-specific as well, too, as far as nutrition. So you're looking at what type of ailment or illness or, chronic disease someone may have, and then tailoring that medically for them as well, too. So there's a lot to it. However, here we started with the FARMacy West Virginia group. And so that's the program that we started with. And then it has evolved to where there was so much success with it that Roane General Hospital said, you know what if we did this year round? What if we did this not just in the summertime for 15 weeks? We created 2 more cohorts so that we're offering this throughout the year. So they looked for grant funding, received grant funding awarded from the Benham Foundation and Sisters Health Foundation. And so in January of 25, we started a year-round program and asked Missy, are you on board with this? Because we really need some resources.
Some help?
Yeah, for nutrition education. And she was up for the task and, of course, has been really instrumental with the program as well.
So like Kim said, through West Virginia Extension Family Nutrition Program, I offer a series of classes, and it's 9 weeks of classes, and it's simple nutrition. We start off with shopping, budgeting, meal planning, and we go all the way through the My Plate, and we just keep adding each week. So it's like we add a little tidbit new each week, and with each week, we do a recipe, and the recipes are tailored to the food that the people are receiving when it comes to Food is Medicine or FARMacy. So those recipes are tailored to what they're receiving. They're getting to make the recipes in class. At first, that's kind of hard because they don't want to get up in front of the class and they want me to do it.
They don't want their own cooking show?
They don't want their own cooking show. But at the end, you'll see the groups come together. They become like a little cohort inside the class, and like you have like little friendships and bonds that are built. And they get up and do those cooking demos with ease at the end. By the time it's done, you don't have to ask for volunteers. They're already in the kitchen reading the recipe and doing all that stuff. And that's the biggest thing with Food is Medicine. You can't just give someone food if you're not showing them how to properly utilize what they're receiving. We talk about how to like preserve it, like how to freeze it and keep it for the year so they can have those fresh vegetables all year long. So like Kim was saying, FARMacy is a little bit different because in Roane County, especially because the first year we did it, we had 30 participants.
Yeah.
The second year, Roane General saw the value in what we were doing, and they went ahead and sponsored 30 more participants. So,
did they ask you before they did that?
Yes, we did meet with Vicki. I think it was after they decided and already had the money, and she was like, "How do you feel about 30 more?" And I was like, Sure, let's do 30 more. But the more people that you get in, the more people that you're doing. I mean, it's like word of mouth. Like now we have waiting lists trying to get into the class.
Really?
Yeah.
Well, that's crazy. Good to have, obviously. Now, Kim, you've been in a podcast or two with me where I've really railed on this in that people don't know what they don't know when it comes to food and how it affects your physical well-being, how it affects your mental well-being, how it can affect your sleep, which also affects your mental and physical well-being. And for the longest time, I don't know if it's specific to rural areas. I mean, it may be a little more that way. It may be, the demographics or, some poverty issues, whatever it may be. Habits over many years that people, families just seem to pass down. A lot of people just don't understand how to eat properly. People don't understand how to cook the food properly. People don't really recognize what they're putting in their bodies sometimes. And so you have to approach this system like you're teaching kindergartners, and then they become first graders and then become second graders. You're going to the base level of, okay, yes, you may be eating chicken, but if you're eating fried chicken, might not be as good as these other ways to do it. So talk about that. Talk about like breaking through these walls and these barriers that people just, do you ever see the aha moments is what I'm asking. Do people have those aha moments like, whoa, I did not realize this was going on. I didn't realize I was doing this.
Well, I was going to say, I think the biggest thing, we'll see those moments like that, and they're like, oh, I didn't know that, or, oh, that makes better sense to me now.
They'll flat out say it then.
Oh, yeah. After they get comfortable with you, they will flat out be like, yeah, well, this is how I've always done it, and now I'm doing it a little bit different. Even goes back to like food safety. We talk a lot about food safety in our classes, and we learn a lot of things in our classes, and like I'm like, oh, don't eat at so-and-so's house. Or, just learning those little tidbits. And like the biggest thing we always say in our class, and Kim it's like small changes. It's not about the wow factor. I don't want you to change everything that you're doing. It's about making those small changes that are going to last. Yeah. Not changing up your whole diet, but just introducing new things, healthier things, and maybe just a new way of doing things. And that, like, I feel like that gets the point across to them. I mean, like, they'll come back and be like, oh, that's how I'm doing it now, or it's unbelievable.
Well, I suppose if you give them the initial tools, and as you say, not to completely overhaul their diet, maybe just naturally it becomes a domino effect where they start implementing some of these things, and then they just start naturally implementing them in other areas of the way they're preparing food or eating. So obviously, the 30 went to 60 immediately, and obviously you guys have seen this go from a summer program to a year-round program. Loaded question for you guys. How has FARMacy West Virginia impacted our community?
Yeah. Well, FARMacy West Virginia is designed so that it's 15 weeks, which is a commitment. So once a week, participants are coming in, they're doing a cooking class with Missy where they actually cook something, they're able to sample something, and then they get some fresh produce to take home as well too. Yeah. Along with that, we offer pre-labs and post-labs. So we take their lab work in the beginning, see where it's at, have them in the program for 15 weeks, and then we have the luxury of offering that post-lab to really see the impact of that in number format as well too. So a lot of times they'll feel a difference, but to actually have those results to be able to give to their doctor, hey, they've participated in this program. So we have seen some measurable results with that. Some of the things we look at is cholesterol, triglycerides, A1C levels when it comes to blood glucose. And then recently, with the addition of our in-body scanner at Roane General Hospital,
love that thing.
In Prescription for Your Health, we're looking at skeletal muscle mass, visceral fat, and percent body fat as some of those metrics as well too. So it has just evolved and continued to grow, but it all started with that really good structure from FARMacy West Virginia. And Roane General saw, those results even on paper as well too. And, that was just something that was kind of a no-brainer for them to expand upon.
Well, Missy, you, as you said, have been involved with this stuff for quite a while now. Is this the first time you've seen this in, I don't want to call it a clinical environment, but is this the first time you've seen this introduced by a hospital itself, or is this something that's happened in other areas with hospitals? Have you, with what you're doing, with your portion of this, have you seen such in-depth things that are happening, such as pre-lab, post-lab numbers, the in-body scanners, like a hospital that is truly digging their heels in to help out and give the information to these people?
I will say that when it comes to Roane General, they are putting the effort in, and they're actually like with the 1-year program, they're making a big difference. I mean, they're seeing the value in it. Most places that I teach pharmacy classes in, I teach in 2 different counties. The programs are totally different. I've got one hospital who's completely committed, and I've got a clinic who's committed, but they're still like wavering a little bit. I mean, like I don't have a waiting list at that clinic the same way I do here because it's just the structure is different, and their providers aren't, the providers aren't. I don't know what the word I'm looking for is. They're not pushing that program. They're not prescribing it.
They're not quite there yet.
They're not quite there yet. I mean, that's just the difference. You know, when you've got a program that you have the hospital or a clinic backing you, it makes a total world of difference, especially with participants, because, like I said, they get that sense of community. Yeah. And at Roane General, all of our participants have that sense of community, and they feel comfortable with asking questions, coming to the gym, and doing all those things. And I think that makes a huge difference.
Without going 18 years into the future, Kim, when you hear stuff like that, and no other places aren't quite doing it yet, and I've talked to Doug about this many times, and I think I've maybe mentioned this to you before. Do you feel like, this wasn't obviously you wanted to be a pilot program for this, but do you feel like you're cutting edge with this, and do you foresee a future where people are coming to you, hospitals, places like that are coming to you guys to get information and maybe starting to implement stuff?
Well, not to reveal any secrets, but that's already happening.
Divulge whatever you must.
Well, I was going to go back though when I was, looking at taking on this position. I was pretty happy where I was previously, so I was really exploring it, and that was one of the questions that I had, is this something that will be innovative? Is this something that will evolve? And basically the answer was yes, get ready, buckle in. So that was something that I think has been here all along within the works. It is a model that's very proactive. It's not really a great business model for a hospital, to tell you the truth.
Have said it to Doug numerous times.
Sick people make money for a hospital. So it's a stewardship program as well, too, doing the right thing. And we have really good resources for that. And it's starting to show where other people are seeing the difference. Yeah. And they're also, they're hearing the stories. And in addition to that, they're seeing some of those numbers to back that up as well, too.
Without going fully revolutionary, it feels like the administration here and what you guys are doing is one of those things that I mentioned it in a podcast recently. I said they're cutting their nose off to spite their face. But on the opposite side of that, they're also providing high-quality health care for the reactionary things, but on top of that, they're being very proactive with what's going on with this. So we talked a little bit about how you guys kind of got together with this. Now, I tend to believe that the administration here, Missy, is very data-driven, very data-oriented, but there's a lot of just organically coming together with this stuff where they're taking a look at what's working and then they're just saying, well, let's do more of this. And so you come in, you've added to your numbers, obviously. And if somebody's thinking about this, I want to know how this works. How does you mentioned 15-week program. So how's it structured? What if somebody gets involved in this food as medicine program in the FARMacy West Virginia stuff? What do they do? What happens? I heard a little bit about it. I heard, okay, so there's some numbers and then there's some cooking. Mm-hmm. Take me through the class completely if you can.
Do you want to start off with registration?
Oh,
how do you
register?
Absolutely.
We're getting to the bare bones of this.
Yeah. So the Food as Medicine program at Roane General Hospital is offered for prescription for your health participants. So we want this to be a supplement. We don't want it to be a standalone. We want overall health and wellness. And so we're looking at all of those resources, including medical fitness opportunities. And in addition to that, having the nutrition education, of course. So we have applications for anyone that's interested already in our prescription for your health program. We have cohorts that occur in March in June and in November. So about a month ahead of time, we're putting out those applications, making sure that everyone knows that this is available and they can apply for it. So far this year, we've had 45 openings for all 3 of those cohorts. So right now, we just finished up one not too long ago, and then we're going to be starting around November 6th, we're looking at.
It's just a small break.
Yeah.
Just a small break.
It's a lot of turnover in a short amount of time. But it's really fun. And Missy can speak to what the class looks like.
Yeah.
Because some people come in and they're not really sure if they can commit. They're not sure what to expect. So it's a lot more fun than you would think. And from an outsider, if you hear people in this class, you're probably thinking, what in the world are they doing? Because they are, having a good old time. And they smell good food cooking and all that good stuff.
Mm-hmm. So when it comes to the actual class part of it, I teach a curriculum called Eating Smart and Being Active.
Okay.
And it is based off the My Plate. Most of the things that we teach are going to come from My Plate. So most people are familiar with My Plate, and it's, you see it everywhere.
Yeah, if you guys are not familiar with it, by the way, sorry to interrupt, there is a podcast that we did with Vicki Withers, and it was the plate method. Mm-hmm. We wanted people, you can go back on our YouTube channel, find the episode, and we laid that whole thing out for people. So
we take it a step farther. So when we do the classes, like Kim was talking, we try to have fun. Like, it's not like come down, sit down, and be lectured. Like, it's very interactive. We interact with each other. After we get familiar with each other, everybody's like talking to each other, giving us their suggestions. Sometimes they're good. Sometimes they're bad. Sometimes we're scared. I mean, you just don't know what you're going to get. But we go through the whole My Plate. So, like, one of the lessons is plan, shop, and save. Very first lesson we do after we get moving is plan, shop, and save. And we talk about, like, how to plan out your weekly menu, how to plan out your grocery list, and, how to budget and save money, which is really important to most of our participants because lots of people are living on that really tight budget. And then we go through each section of the My Plate and really discuss it and really talk about how we can make those changes in our lives to make that plate work for us and, what's important to each participant. And, each class is going to be a little bit different. But typically with the Prescription for Your Health or the FARMacy people, we really focus on what they're receiving, the time of the year that they're receiving the vegetables and what kind of stuff they're receiving. And then we do a lesson called Make the Change, which I think that's about everybody's favorite one because I usually ruin everybody's thoughts on fast food.
Oh, no.
Yeah, we usually, and they laugh at me because I usually can tell you like what calories are in things. And it really gives them an idea of like thinking back of what they're doing and how to make those small changes. Like that's the biggest thing we talk about in every class. It's not about drastic changes in our life. It's about small changes that are going to make a difference.
How many people have done drastic changes and it hasn't lasted? Me 4 or 5 times. People they'll register with that. They'll understand that. Well, I tried to overhaul. No, can't do it.
Well, and we even do that when it comes to we do physical activity in the class too, which
Really?
is very funny sometimes. Very, very funny. We do physical activity in the class, and it can be as simple as like doing chair exercises. We introduce stretch bands this session, 15 weeks. Who knows what we'll do next 15 weeks? I mean, you just never know. You may see us walking the streets. I mean, we have
walking backwards.
Walking backwards. I have had groups that we've walked backwards on avenues in classes. So I mean, like, you just never know what you're going to see in our classes. And like, we've had people who have done the class multiple times, and each time they'll all say, "Oh, I did learn something new this time," or "Oh, that really clicked with me this time," versus what we did last time. So, and like you said, we do a cooking component. So we get a recipe, and everybody's really excited about that every week. What new recipe we're going to get. I try not to repeat recipes unless they're like a favorite of the group. We try to do all new recipes that are like seasonal recipes that go with the season. They get to cook the recipe in class. They get to try it. And if you're in Prescription for Your Health, they actually get the protein that goes with the recipe to take home. So they'll be able to make that recipe, which I think is super exciting when it comes to that program because no other programs are really giving out a protein to go with it.
Let me ask you real quick. How do you cook all this stuff? Do you have to bring in how does that work?
So before this year, after the hospital purchased the mansion, we got to go to the mansion and cook, which was amazing because they had a kitchen, they had a sink, they had a stove, they had an oven.
Yeah.
Before then, I had a mobile kitchen in my car. So I would bring hot plates, little ovens. I mean, I would be washing dishes in like the little conference room up here, like in between classes, because it's not just one class. When you talk about 45 people, it's 3 classes of 15. So I would be like prepping for a class, washing dishes, running back and forth, and I always say that last class, they really get the short end of the stick sometimes because I'm like, did I already say this?
Yeah.
Maybe. Do you guys know this yet? So, yeah, we try to make it as fun as possible.
I'm getting like flashbacks right now to my freshman year in the dorm at WVU, just like hot plate and just do what you can do.
Oh, that's exactly what it is. Like, you should definitely come and view one of our classes. You would probably be really entertained.
Yeah. And so we go through this classes. I wanted to touch again on the labs, the pre and post labs. As you said, this is designed for Prescription for Your Health members. So this is something that already is offered to them, the labs and things like that. So is this something that is required of this Food as Medicine program, or is it just another one of these things that they can utilize in Prescription for Your Health?
That's one of the questions on the application is, would you be okay with lab work that's free of charge as well too? Most people really want that lab work as well. So it is built into the program, but it is something that we like to be able to measure, to be able to show even our grantors that are, awarding us funding sources to make this program possible. We want to be able to produce some information for them as well.
The proof is in the numbers, honestly.
Yes.
But
and we want to assess our program all the time as well, too, to make sure that we're making an impact and being as effective as we can.
And I think that when people see the numbers change, I know just personally that InBody scanner is insanely wonderful for me and for everybody I've seen utilize it. And if you're honest with yourself and if you're doing things the right way, you're going to see numbers change. Your blood work is going to be better if you truly dig into the program. And so the numbers are very important for people who we've talked about this before, Kim. You and I have talked about, for the longest time, people who were trying to become healthy or well, they attached it only to a number on a scale. There weren't any other metrics that could be utilized. And so now with this program, you've got massive amounts of information, data that is good for you all, as you said, for the program, but it's good for the people who are utilizing the program. It's what they need to see.
I will say, like, with doing the program, the great thing is they get that blood work, they get those results back during class. So they have questions, they can come to Kim, they can go out and talk to Kyle in the gym. And this last session of classes, I mean, people were so proud of the results at the end. It was like heartwarming to watch them. And they all, that's the great thing. Like I said, it just builds that community. Like within those classes, you see these little social groups building. And then I'll come up here like on a Wednesday that's not even a day of Prescription for Your Health, and I'll see groups of my people at the gym together or coming out of the pool or on the walking trail. I mean, so it's giving people that sense of community. I mean, you can't build that in a classroom. I mean, they're doing that on their own, but when they have their test results back and they're comparing them and they're like so proud of what they've done. Yeah. Because like our biggest thing is we say, like, it's not about the wow factor. I know we've said that before. It's not about that wow factor. It's about those small little changes. I mean, it's not about I lost 30 pounds. It's about, I lost 5 pounds and this is what I did to do it. And this is how it's going to last. I mean, like, it's so amazing to see those groups come together and to see like that little community and how proud they are of each other and how proud we are of their results. Yeah, sure. I mean, lots of times we're more excited about it than they are.
And that was one of the questions that we asked our last group, did you meet someone new? Were you surprised by, and they all, when you're in a group together 15 weeks and you all have a common goal, to kind of learn some new things and work on your overall wellness, you just naturally get to know people and support each other. It's in a positive environment. And Missy makes it so realistic as far as everything goes. And in addition, she just makes it fun. So we laugh together. Like, laughter is some of the best medicine as well. We should make a program for that. Laughter is medicine, maybe. That's our new innovative one. But I think there's a lot to that goes beyond the numbers and the measures that we're seeing.
When we talk about people being motivated to be healthier and well, and motivation can only last so long. You know, I guess motivation could be a daily or an hourly or a minute-by-minute thing. Excuse me. You're not looking for the wow factor. What you have to have is consistency. Yeah. And so the social aspect of that is really big. And it's one of those things that you touched on the first time I spoke with you, and I was like, man, I don't even think about these people who need that social interaction for their own sort of accountability. They got accountability buddies in this program. And what that does is it allows them to be more consistent. It allows them to keep coming back through the 15-week program. It allows them to get back into it the next year and the next year after that. The wow is in the change over time. And you guys are this is very new still. I mean, with regards to, you're talking about 10, 15, 20-year programs. This is relatively new. What is the impact, though, that you guys have seen in the small amount of time, logistically speaking, a small amount of time? What are some of those great impacts you guys have already seen in the changes of the people who have been involved with these programs?
Well, I'm going to say one of those impacts is that we've seen in the beginning, we were recruiting people. Vicki was on the phone, and she was saying, hey, I have this program. I think you'd be great for it. Are you interested? And we're to the point now that we barely get the word out, and we have flooding of applicants. So I know word of mouth has gotten out. I know that it has impacted people, and it just really means a lot to them. And they are always interested in learning more. And then on an individual level, we see that all the time, and that happens every week of the program, that we see little things that we know, things are making a difference to people.
So the data is there on that part of it, and then the what is it called? It's not data. It is just by the human eye, you can tell there's a difference. I'll get that word at some point in my life. Anyways, but so you see the data, you see the changes. Obviously, the numbers are there. Yeah. The hospital sees the numbers. They're backing it. What do you see for the future of this program as far as that's concerned? Is it just more consistency on your all's part of continuing to do this program? Do you have any other ideas for like expansion of the program? Anything you're allowed to say?
Our new thing is that we're really kind of diving into the pillar of medical fitness in partnership with this as well too, and really FARMacy West Virginia focuses on nutrition education. So now we have the in-body scanner that we can add those metrics into that to look at the effectiveness of the program. So if we add some additional, not every pharmacy site throughout the state has access to a free gym or medical fitness or trainers or
pretty
instructors.
Lucky here. We'll say that.
So that's one resource that we're really looking into, making sure that access is amplified a little bit to see if that also, makes a difference with our cohorts that we work with as well. So
you mentioned that there's a break. I'm not sure when this podcast will come out, but I think it'll still be during the small break. Somebody wants to get involved with this portion of Prescription for Your Health. They need to go be a member first, is that correct?
Yes.
So they need to come see you or go see Kyle or whoever else is in the wellness center. Track somebody down here in this building. And then tell me once again about the dates that are coming up for the programs and the length of the program again for people who may have missed that part of it.
Sure. So it's 15 weeks altogether. We operate groups starting in March and then in June and then in November. Okay. So if they start in November, it will go through about February, something like that. Small breaks start in March and then just keep rotating from there.
And your job is to find the stuff that fits those times of year.
Yeah.
Is that correct?
We've actually had fun with the recipes for the fall, winter, because this is actually
how much pumpkin spice has been asked for?
None. None. We haven't done anything pumpkin spice. Gosh, now you've really got me with my wheels.
I will say it is while we're recording this, it is still early fall while we're recording this. So You still got 2 months of pumpkin spice before you switch it over to peppermints
Yeah.
and the Christmas season and all that stuff.
Yeah.
So
Yeah. So when you think about that, all the recipes that we use are all USDA My Plate recipes. So they're all going to have that. They're going to meet those nutritional guidelines that the hospital's looking for. You know, they're going to be great for diabetics, great for someone who's coming out of like some cardiac issues. You know, these are recipes that are good starting recipes.
yeah.
Maybe you might want to tweak it a little bit at home, but you know, as long as you use that good foundation on it. We always talk about in the class, how would you change this at home?
Yeah.
And like I said, they're good foundation recipes, and finding 15 new recipes every time has been a kind of a challenge.
Yeah.
And thinking about what people like and what they want, and not trying to like rock the boat too much, you know.
Yeah.
Sometimes we try to do something different.
Yeah. Missy has little Missy tips.
gosh.
So she does talk about, people usually say, I would add salt. You know, when she asked the question, what would you do, you know, with this at home, or how would you do
So
this
immediately I would
differently?
add butter and salt.
Yeah, I mean, it's just kind of how we've grown up, probably. So, I mean, it kind of blows people away sometimes that you can add in different spices as well, too, like some garlic powder and, you know, little things like that can kind of do the trick of the salt. But there's all kinds of Missy tips. So it's always entertaining. The salt is definitely one. And she always says, like, we talked about expired food, you know, if it's a can of something that's 79 cents, like it's not worth dying over, you know.
Not
If
dying
it's
over
expired,
79 cents.
79 cents is not worth getting sick.
Yeah.
I could have probably used, speaking of college again, I probably could have used that that mentality. I'm surprised I'm still alive these days. Well, obviously you're passionate about doing this, Missy, which is wonderful because you're involved with the Roane General Hospital 4-Year Health Program. I'm glad that you and Kim have collaborated. And I'm glad, again, that the hospital, Kim, has backed this. It's just another great opportunity for people in our area to continue to find more ways to improve their health and wellness. That's the overall goal of the Prescription for Your Health program. And I'll continue to promote and tout what you guys are continuing to do in this program, in that there are very, very few excuses that can be utilized anymore. You have the information. It's available to you. It's available to you when it comes to eating right, nutrition. You've got trainers. You've got the information. You've got people who put plans together for you. You've got the information. You've got everything at your fingertips in a small rural area like Roane County. If you don't utilize it, that's where the accountability comes in. You got to utilize this stuff. And I'm glad that people are flocking to this program. I'm glad people are really enjoying it. Beyond that, I'm glad they're talking about it, because when they talk about it, more people want to get involved with it. So thank you guys for this. And again, I was very excited about food as medicine. As you said, it's an obvious statement, but sometimes the obvious isn't always obvious. And so thank you guys for continuing to do big things here. Thank you for giving people the information they need about proper eating, because that's a huge part of getting well. And that's the reason we're doing Prescription for Your Health, as far as I'm concerned, right? We are doing that to help people get.
Yeah, I think so. I think that's
Think
the
that's
whole
what we're doing?
goal. Yeah, pretty sure.
Well, guys, thank you so much for this. It's been a very important podcast. I will continue to push the food portion. I'll continue to try to eat healthy myself. We're going to talk about the Whopper I ate this weekend here in just a little bit when we're off the air. Missy Painter, Kim Mertz, thank you guys so much for the information.
Thank you.